Hello, everybody. According to my watch, it is 1 o'clock, and it is time to start our webinar, which is going to be how to find billing information for RHC. This is going to be some basic principles. It's going to teach you guys how to fish. That's basically what this is going to be about, is how to get the answers that you need for your RHC questions. Introduction to our team. My name is Mark Lynn. I've been working in the Rural Health Clinic program now for 35 years or so. I just saw where Dr. Dale Paget is retiring down in Bamberg. That was actually the first rural health clinic I ever worked on in South Carolina in, like I said, probably 35 years ago. So Dr. Paget is retiring. But I've been around RHCs for a long time. Danny Gilbert has been with us for a long time, not as long as I have, but she's been with us. She's my partner, and she'll be ongoing with healthcare business specialists in the future. She knows all about 855As and provider enrollment and cost reports and TennCare reports and all that sort of stuff, and keeps us all in the right place. Paige Chambers works on emergency preparedness and cost reports. Trent Jackson works with us, and Trent works on evidence binders, cost reports, preparing for the inspections, program evaluations. Both Paige and Trent will be out helping us do those as well. So you may run into any of these people in your emails, and we apologize for the beginning here where we have a little bit of advertising, but if you've ever listened to any podcasts lately, seems like all you get is advertisements. So you can get a little bit of advertisements at the beginning here. We do about 300 cost reports every year. We do a lot of program evaluations where we go on. That's a requirement every 2 years. That is a condition level deficiency. If you don't do those, you don't want to wait and get a condition level deficiency, because it is a lot of work, and you only have a very limited amount of time to fix those condition level deficiencies. We do a lot of startups or converting practices into rural health clinics. We also do a lot of emergency preparedness. Paige does a great job in doing your after action plan, your tabletop sessions, your training. There's a complete webinar that we do with your staff where we help train you and walk you through an actual or an event. So that will be good. And then, of course, Danny does the TennCare quarterly reports if you are in Tennessee. If you haven't joined our Facebook group, we have about 4,700 members in it, and anybody can join, anybody can share information. If you've got information about seminars, webinars, conferences that will be helpful to our rural health clinic community, then please join and share that information. We're very happy to let you share. It's not just for HBS clients, it is for anybody and other consultants if they want to use this and post information about what their services are, or what types of conferences or seminars or anything that will help you guys. We highly recommend it. Our website is ruralhealthclinic.com. All the materials that we have in this presentation will be loaded on here. Also, we did put 5 handouts there, so your presentation that I'm doing today will be in the handouts there. May or may not work. The slide presentation is huge, and sometimes GoToWebinar does not like it. We did post it on this website, on the Rural Health Clinic website, and we did put it in the Facebook group as well. So if you want to download this, you'll get it. You'll also get an email. If you registered for this, you will get an email with the recording of the session. So if you need to leave early, or if you couldn't make it, you can do that. Next week we have the big show where we're going to have Amanda Dennison, who is absolutely fantastic, and she's going to go into basics of 101 billing. And then Patty Harper, and we all know Patty and how fantastic she is. She's going to do a 201 session. And then Charles James, I've known Charles for 35 years as well. As far as rural health clinic, he always talks about how we were the only vendors back in the day of the beginnings of the NARHC. And so Charles will be doing the advanced subjects session after that. And we are going to add one more session after this one. It's going to be on billing. I called this initially, I called this we were going to go over a pre-test. In looking at the amount of material we have, we have way too much material. It would be a 2-hour webinar. So after we do the 301, we're going to have a post seminars test, and we will go over that test and go over some answers for that after everybody has done the session there. So otherwise we would have had a 2-hour webinar today. And there's a link if you just want a direct link into signing up for Amanda's. Do sign up for Amanda's. Hers is by far the most people have signed up for so far. I'm not sure what our limit is, but go ahead and register so you don't get held off on registering for that, because we do have a maximum we can register for this. There's the other 2 webinars that we talked about as well. Disclaimer, everything is current as of today. In fact, I loaded a couple of last second MedLearn MLN Connects webinar or newsletter that came out this morning with some super important information for rural health clinics. So I put that in your slide presentation as well. So everything is up to date. Everything is being recorded. Some people, if they don't like it being recorded, you can leave and questions. If you do have questions, if you'll type those in the side over here, we will answer those at the end, and we will post the recording on our YouTube channel as well. What are we going to do today? We're basically going to, like I said, teach you how to fish. We're going to show you the organizations that are going to help you run your rural health clinic and help you with billing guidance. And we're going to show you the resources that you have, and you are going to see some common billing issues here as well as we go through this. So we have basically 3 different sections: executive summaries of billing issues with rural health clinics, organizational resources that you can go to find information, and then what are the CMS, the Medicare billing resources that you can go to, and again, teaching you sort of how to fish. Executive summary of rural health clinics is they bill on a UBO4. It's actually a Part A methodology that payments come through, although the actual funds, the trust fund, is Medicare Part B. So if you're on Medicare and you have Medicare Part B, you get one of these Medicare and you can say, how old I am. I got one of these this year. Medicare NU 2024, it has everything laid out in it, what benefits you have if you have Medicare Part B. So it would have been so simple if, when this all started, in 1977, if instead of setting this up under Medicare Part A system, if Medicare would have just put in a modifier that said RH modifier and kept us billing on the 1500 form, everything would have been so simple, but they didn't do that. We have to bill our RHC services on a UBO4 form, and that makes a big difference there. It only affects original Medicare. Occasionally you will have a Medicare Advantage plan that will pay you the higher rate, so reach out to them. But in general, they do not. They're not required to, and they don't. Also, you may have issues with crossovers and secondary payer issues when you become a rural health clinic. So you want to keep that in mind. Here is that document. I would highly recommend that you get this Medicare NU, even though you're not old enough for Medicare. You can get this document here. You can download it. That one there will not have at the end of these booklets here. It's really important if you can get one from your local area, because you'll see all the Medicare Advantage plans in your particular area. I would call them and notify them and let them know you are a rural health clinic and negotiate with them to get paid your RHC reimbursement rate if possible. And you can get that list of those Medicare Advantage plans that work in your area as well. And this is open enrollment time. It's open enrollment time until December 7th. I would always let your patients know which Medicare Advantage plans you accept and which ones you don't, because more and more providers, more and more hospitals are not accepting Medicare Advantage plans because they don't pay you what you probably should be getting paid. More executive summaries here. RHCs can be either independent or provider-based, and then provider-based, may be either grandfathered or they could be subject to the national statutory limits. If they're grandfathered, they were a rural health clinic in 2020 or had an 855A in the pipeline by December 31st, 2020, and they will get what's called a grandfathered RHC rate. Those are subject to a site-specific cap for that particular rural health clinic. That applies to provider-based RHCs. If you're an RHC that's in a larger hospital with 50 beds or more, or you became a rural health clinic in 2021 or later, you are going to be subject to what's called national statutory limits. And then if you're an independent RHCs, you'll be subject to those as well. Here are the rules on the RHC billing. Again, these billing rules only apply to Medicare. We won't be talking about Medicaid because if you've seen one Medicaid program, you've seen one Medicaid program. And for that period and at that time, because Medicaid is always changing. So you can't really make general statements about Medicaid programs because they're all over the place. Again, you're going to bill your services on a UB04 for RHC services. There are some services that are non-RHC services that you would bill on a 1500 for an independent RHC. If you're a provider-based RHC, you wouldn't bill on the 1500. You would bill it on a UB04 on the outpatient MPI number for your provider-based RHCs. You would use a bill type. It's either a 13X or a 114X would be the bill type that you would be using for that. So, and that's called split billing, and that's you have to have a really good computer system to figure out where those claims go. And then all the visits that are covered under the RHC visit, they are paid what's called an all-inclusive rate. And then the other services like laboratories, technical components, CCM, chronic care management, those are billed on a fee-for-service basis, and you'll get paid fee-for-service. Now, if you're a provider-based RHC and you're attached to a CA, then you will get cost-based reimbursement for some of these items here. I did put together a cheat sheet for you. I think that's on the slide after this, and so let me read this slide, and then we'll go to the cheat sheet that's next. The advantage to the RHC: there is no 15% reduction for rural health clinics for your nurse practitioners, your PAs, and your certified nurse midwives, like there is fee for service. Also, the incident to billing rules are a little different. As long as you have it in your policy that services can be provided incident to a nurse practitioner or PA, then you can those services will be considered incident to a physician. It doesn't have to be directly on site for rural health clinics, which a lot of your incident to rules require that. Do remember, and I would go into chapter 13 of the RHC manual, read section 120, 130, and 140 related to incident to rules. Do remember this only applies to Medicare. So you gotta be real careful with your commercial insurance companies. You need to have every provider with their own individual MPI number and credentialed with each of your payers. Because what happens is, I know we had a situation where we had providers that they basically used the MPI number of the physician, even though he really wasn't there, and Blue Cross came back and said, we should have only been paying 85% for these nurse practitioners. We want 100 grand back. And so you do not want that to happen to you. So credential all your nurse practitioners and PAs with every insurance company. These Medicare rules are that Medicare rules, so they don't apply to the Blue Crosses of the world. And then RHCs do have a particular requirement there that you have to have a physician, nurse practitioner, or PA, or a certified nurse midwife physically on site before you can room a patient. They can be in your waiting room, but you can't go back and lay hands on them. Also, RHCs are not subject to the 3-day payment window. If you're owned by a hospital, then you don't have to bundle that into the DRG for that particular one. Here is the cheat sheet that I came up with this morning, so I haven't really vetted it with anybody. So if you see an error in it, let me know and I'll fix it. But the green stuff here, this is your Medicare Part A services. And so the first thing is, if they're covered under the all-inclusive rate, right now the national cap is 126. It's going to 139 next year. And for those services, you are going to bill on the UBO4. Things like face-to-face encounters, there is a document called a QVL, Qualified Visit List. It hasn't been updated since 2016 in the published format, but anything that's on that QVL, that's what you're going to bill on the UBO4. Things like 99212, 99213 procedures, incision, abscess, those 10110 series there. You can tell I'm not a coder. 10. I get really good on cost report season when I have to go through and count the visits, but this time of year I don't have to count that many. But those that are on that QVL, that's what's going to count. Also, if you have a telehealth mental health visit that qualifies for an all-inclusive rate, that's going to be on your UBO4. Then there's also services that are called Incident 2. Incident 2 are services that are not on the QVL that would not qualify for all-inclusive rate, and they occur within a medically appropriate amount of time. Medicare doesn't define that number, but it's typically between 30 and 45 days, either before or after an office visit. Some of the things that are Incident 2 are allergy shots, lab draws, or Hep B. You're not going to get paid any more money from Medicare on Incident 2, but it will increase your copays and your deductibles from your patients if a deductible applies to that service. So that's Incident 2. There's not a very good system to deal with Incident 2. Let me just tell you, all the options are terrible and confusing and hard. And then there's other services that are Part A services that don't get billed on a UBO4. They don't get billed on a 1500, and they're not UBO. They're not Incident 2. Those are roster billed, and they go on the Medicare cost report at the end of the year. It's influenza, pneumococcal, and COVID-19 vaccines. Those will all, you'll write down the patient's name, their MBI number, which is their Medicare number. We used to call it HIC number. You put that on there, and then you give them the date that you gave them the shot. So those three items are roster billed. MABs, if you're still doing MABs, those would be roster billed as well. We just don't see a lot of that. And then the last part of they're still Medicare Part A services, but they're not covered under the all-inclusive rate. They will still go on the UBO4. They won't count as visits on your cost report, and you'll get paid a fee for service for those. Things like chronic care management, CCM, that is your biggest one. I think the new rate for CCM next year is going to be $72.15, and it's going to go down from, it used to be in the 80s, now it's $72.15. But the good news about this is you can bill that G0511 code more than once, because they're rolling remote monitoring in there, and two other services, PIN and CIN. Nathan and I talked about them yesterday on the virtual office hours. If you're not doing that every other Wednesday at 1 o'clock Eastern time, Nathan and Sarah from the National Association of Rural Health Clinics has something called virtual office hours, and a lot of people use that. So definitely you'll want to do that if you have questions. But I asked that question yesterday: what is this CIN and this PIN stuff? And it's brand new stuff for next year, so you'll want to look at that and learn more about it than what I know at this point. And then telehealth, the E&M portions of it, the E&Ms, those are paid on a fee for service as well. I think it's like $98.25 or something like that. For those, you don't get the all-inclusive rate for that. That's all the stuff that's covered under the RHC benefit, even though some of these aren't paid under the all-inclusive rate. Over here in the blue category, this is Medicare Part B. These are things that are paid fee for service, and for an independent RHC, you bill those on a 1500. Things like all lab tests, including the 6 required lab tests, you can bill those to Medicare Part B and get paid fee for service. Anything you do in the hospital, you're gonna bill that on a 1500. The one exception would be if there's a swing bed patient, and that swing bed patient is swung to being a nursing home patient, then you can bill that on the UB04. But if that swing bed is being used as a hospital bed, then that would go on a 1500 form. And then finally, technical components. Those are billed on the 1500. I said radiology or EKG, that's a good example. The 93005 portion of that, the technical piece, you can bill that to Medicare Part B and get paid fee for service for it. The interpretation piece of it, the 93010 portion of it, that will be incident 2. That will go on. That will be an incident 2 service. So keep that in mind. And then finally, over here in the red, that's Medicare Part D. Those are things where Medicare Part B only covers these particular influenza, pneumococcal, COVID, and Hep B. Any other vaccine is covered under Medicare Part D. There's no way to get compensated for that through the rural health clinic. My system went down. So.
Oh, you're back on.
Oh, I'm back on? Okay. Okay, good deal. Good deal. Okay. Okay. Oh, okay. Hi, everybody. Hey, Danny, where did y'all stop hearing me then? Because I was just, you know me, I was just going.
I don't even remember. Go back on your slides, and I can tell you. You were on this slide.
Okay. Do you remember Paige or Trent? Do y'all remember where I was on this when it stopped? Obviously, Danny wasn't paying attention. She's only heard this about 1,700 billion times in her life.
No, go back one more slide.
Is that where we were?
Yep, that's where you were.
Oh no, I did such a good job on describing the other one. Oh, okay. I'm sorry, everybody. I apologize for the technical difficulty there. I'm not sure why. It's a beautiful sunny day here in Chattanooga. So I don't know why. Do you remember what portion of this did all of it or just a half of it, Paige? I'll just do the whole thing. How about that? Okay, let's go back to where we were. RHCs pay nurse practitioners, PAs at the same rate as physicians. There's no 15% reduction for them. The incident 2 rules for billing for rural health clinic is different. What you want to do is look at section 120 of chapter 13 of the RHC manual and put in your policy that services can be provided incident to a nurse practitioner or PA or certified nurse midwife. that is required for you to provide incident to services
Hey,
to.
Mark,
Yep.
you were on part D on the next slide.
Okay. All right. Got it. Good. Okay. Good.
I thought you were on that slide. Okay.
Okay. Okay. So I was all the way to the part B. Thank goodness. Okay. Good. I was like, oh man, I have to repeat all that. Okay. So we're on part B. Part B is paid fee for service. It's paid on it's built on a 1500 form. This is for your lab test, all lab tests, including the 6 required lab tests to be a rural health clinic. You can bill that to Medicare Part B and get paid fee for service for that. Anything you do in the hospital is going to be billed on a 1500. The one exception that you could possibly run into is a swing bed. A swing bed means one day it's a hospital bed. Then when the physician decides, okay, you know, mama's better, we're going to make her now it's going to be a nursing home bed. We're going to swing it to being a nursing home bed, and it will be paid as a nursing home bed at that time. If that bed is being paid as a nursing home bed, then you can bill that on the UB04 and get your all-inclusive rate, because that is essentially a nursing home visit at that time. And then technical components, your radiology, think about your EKG. The 93005 technical component, you can bill that on the 1500. The 93010, that is the interpretation. That will go on the UB04 as an incident to service. And then you do not bill 93000, the global fee for EKG. No globals in rural health clinics. No globals, no groups. That's been the standard for many years now. Next year that may change on groups, because there's something called the IOP, which is an intensive outpatient program typically for mental health services. So they'll probably have groups in that. We don't know the rules on that one yet, but that's the possibility. Okay, last section here is Medicare Part D. That's paid fee for service. These are things that these are vaccines: shingles, whooping cough, tetanus, diphtheria. Those are covered under Medicare Part D. You will need, and then we lost it. Anytime we Danny, can you hear me now?
Yes, sir.
Okay, apparently the internet hates Medicare Part D because every time we get to Medicare Part D, it freezes on us for some reason. I have no idea why. So let's just get past the slide real quick, and hopefully it will work. I've turned off my webcams to save space. It's funny how at the NARHC they always say we're dependent on the bandwidth of for everybody, and I've never had any problem until today. So now I know what having a low bandwidth means. So Part D, Transact RX, that is the one that everybody uses for that. So you'll want to, if you're providing these Part D covered vaccines, which is any vaccine besides influenza, pneumococcal, and COVID-19, those, and hepatitis B is covered under Medicare Part B as well. Those services, you can, the influenza, pneumococcal, COVID-19, they're paid on the cost report. Hep B is an incident to service, so you don't really get any money for that. And then any other vaccine like this, those will go to Medicare Part D, and you will use Transact RX to be that person. And there's more companies. We don't have any relationship with them. There's probably somebody else that does it. I just don't know of anybody else besides Transact RX that does this. Provider enrollment as an RHC, one thing to remember is provider enrollment and credentialing are two different things. I wish I would have known that. I sat through like an 8-hour seminar on credentialing, and I really wanted to know about provider enrollment. So I learned that the hard way one time. But if you are your credentialing and provider enrollment piece, there is a company called CAQH, and CAQH, okay, and they're not, okay, so okay, Danny, can you hear me now?
Yes, sir.
Oh, okay, I got the text came back. I don't know what's going on in this town, but Gig City, Chattanooga is not today. So your text just came through. Okay, so there's a company called CAQH, the Council for Affordable Quality Healthcare. That's where a lot of people use to do the credentialing and also be ready for provider enrollment with them as well. For every rural health clinic, you have to have a type 2 MPI number. That's an institutional or a group MPI number. Every RHC must have it. You can have multiple RHCs with the same tax ID number. So you have the same tax ID number, multiple MPI numbers, multiple locations. That's perfectly fine. If you do have more than one location, keep good records from a bookkeeping standpoint, because we will have to file separate cost reports initially as you become a rural health clinic. Now, you may get to consolidate later on, but at least the first 2 or 3 cost reports will have to be separate so we can get your cost per visit established. Medicaid, you're gonna have to re-enroll with Medicaid. That's what we always, Charles James and I, we always talk about the trough of disillusionment or the valley of despair. That's when you're waiting on getting your Medicaid enrollment. You do also want to make sure you get your MPI number. You want to make sure you add the taxonomy code to your MPI enumerator, and it's this taxonomy code 261QR1300X. And then independent RHCs, there's no longer an 855R. They've done away with that. It's now an 855I, or you can use PAYCOSH to reassign benefits. These are for services that are billed on the 1500, your labs, technical components, all of that. You do have to get reassigned. You don't have to reassign for services on the UB04. So, and then here's this just changed. They're doing away with the 855I. Has just occurred, like it's in September of this year. So I would read this document, and that way that's going to let you know what you need to do as far as reassignment and going forward using the 855I. Okay, we've made it through that painfully, but we did make it through. Here are some of the RHC organizations that can help you. National Association of Rural Health Clinics is the only organization that is devoted solely to rural health clinics. So we highly recommend you guys being a member of that. The National Rural Health Association, we're members of that as well. And they cover hospitals and much more broadly than rural health clinics, but we do work closely with them as well. And our rural health clinics are represented with the National Rural Health Association as well. Depending on what state you're in, this is Tennessee, we have the Tennessee Rural Health Association, but look at your rural health associations and join them. They will have lots of seminars and lots of local things that will be specific to your state, especially Medicaid billing. That will be something that you'll want to participate in and support those organizations that can lobby for you on a statewide basis. Because a lot of legislation comes about related to scope of practice for your nurse practitioners, for your PAs. Those types of scope of practice rules, those types of organizations will help you when you lobby for that. There's a company called ArchPro Coding, which is down in Georgia. John Burns, Gary Lucas, those guys do a great job on educating you about billing for rural health clinics. So we highly recommend going to ArchPro Coding, see what they have to offer. They have all sorts of stuff like that. And they tend to work with state associations and will come on site and do 2-day trainings on how to do rural health clinic billing. So that will be a great resource for you. The RHI Hub has all sorts of FAQs on rural health clinics, has wonderful vetted information that is really good. National Rural Health Resource Center, they have all sorts of toolkits. There's a great chronic care management toolkit. If you're starting up a program there, I would highly recommend looking at that, and several other toolkits as well. And then there's the RHC Information Exchange, which we've already talked about that, so you know that. And then our website, if you go to RHC Billing, you can go to that one as well. Here's the NARHC, so here's the link. You can go right to it, and that's what website's going to look like. We highly recommend that you go to the meetings at least once a year. Go to one of these meetings. We have San Antonio, Texas, which is there every year. And next year, we're going to be going to Grand Rapids, Michigan. So that sounds exciting. I'm very excited about going to Grand Rapids and seeing what it has to offer. So definitely put those on your calendar, because I think those will be very helpful, especially if you're brand new to the RHC program. Extremely helpful. The NARHC has an introduction to RHCs that's about 60 minutes long. You definitely, if you're brand new to the program, you'll want to see that and see what's going on there. And then the NARHC, we're working on a project right now about how to start a rural health clinic. That's not ready for publication yet. It's still working on it, but we've got a great team of people that have been working on this project now for a year or so, and that should be coming out sometime in 2024. It will come out as well. Look for the technical assistance webinars by the NARHC. Those will be extremely helpful to you. This one right here, you do not miss this. Sarah Holman is going to do the impact of RHCs beginning January 2024, the new rules. There are a lot of new rules and a lot of new opportunities for rural health clinics. So you'll want to register for that and join that session. That's going to be super, super helpful. And in the cybersecurity lockdown, we saw this presenter in Orlando, and he was great. So, and you guys are at high risk for hackers now with all the things that are going on in this world. We are targets, and especially with healthcare, you are a target. Here is an RHC billing webinar 101. This is what you pretty much what you're going to see next week with Amanda. Amanda Dennison did this one, and Amanda will be repeating that session. So you'll have a live session and an opportunity to ask questions next week. And then here is another one that was from 2021. So it's a little bit dated, but I think this is one that Patty Harper did. And Patty and Jeff did a great job on the coding changes that were occurring. But the E&M code, the way that you coded changed dramatically in 2021. And so Patty and Jeff explained exactly how that works in that. So you definitely want to look at that. The AMA coding guidelines, go back because those changed. If you don't have your providers up to speed on that, they really need to be. So, and then become a certified rural health clinic professional. That's all of our team. We're all certified rural health clinic professionals. There's a test you have to take and pass. It's not easy. It involves a lot of studying, but it is well worth it. You will learn a lot about rural health clinics if you become one. Here's the virtual office hours. They're every other Wednesday at 1 o'clock Eastern. Please join us for that. I am typically there. Nathan is there. Sarah's there. Shannon Chambers is there. Patty is there sometimes if her schedule allows. So you can ask questions and you'll get somebody that will give you a good answer from that. There's how you actually get to it. There's the link to the National Rural Health Association. Here's ArchPro coding that we talked about earlier. Like I said, they will have 2-day, sometimes they have 2-day virtual coding boot camps where you can do it virtually, and then sometimes they have them live. Right now, I haven't seen a whole lot on their agenda for January, for December and January. I think that's typically a slow time, but that will pick up in the future. Here's like the last one there. There was and the price is really good. I mean, $300 for 11 hours of training. And I know I sat through the one with Gary and it was really, really good. I mean, I've been doing this 35 years and I learned a lot from that session. So I know you will too. And I think all of our team has gone through all of these as well. So, and there's a credential that you can get. I was too lazy to take the test and keep my credentials up on this particular one, but it is something that you can get credentials behind your name as a rural health clinic coder. Here's the stuff from the RHI Hub that you can go to, and you can see the types of, here's the frequently asked questions here. And like I said, I think most of these were answered by HSA, if I remember correctly, and they provide excellent vetted answers for you guys for questions that you have. So that's a great place to look for answers as well. There's our Facebook page, which we told you about before. There is our website where, again, a lot of this information, especially emergency preparedness. If you're starting emergency preparedness and you've never done it before, there is actually an emergency preparedness policy and procedure manual template in there that will get you started. It's not perfect, but you'll have to edit it, but it is something that you can use to get you started. There's sample after action reports, there's risk mitigation plans in there. There's the Kaiser link is in there as well for the all hazards review as well. Here are the previous recordings. You notice that our recordings were a little bit old, and we finally got around to updating these recordings for this year. So next week's recordings, we will replace these with the updated recordings for you guys. So I think that's what's important. CMS reference materials, RHC fact sheet. There was one that just came out in September 2023. This is a great, very easy to read, very childlike with all the different pictures and stuff. I can really relate to it. It sort of hits me on my level. So that's the first place you'll want to go to study about rural health clinics. Second place, chapter 9. We call chapter 9 and chapter 13. That's our Bible for billing. So you'll want to go, you'll want to put those in your brain and study these. They're not very much to them. You got 13 pages on the fact sheet, 41 pages on the claims processing manual, and 61 pages on chapter 13. And really, you only have about half those pages that apply to you because FQHCs and RHC information is in those two documents. Don't read the FQHC stuff. That's going to get you confused. Look for the rural health clinic stuff and only apply that, because some of the rules are different and they will not, the FQHC information will not apply to you. There's another chapter 13 that it basically, it's the same document. It's just an updated version of it. Chapter January 26. It has all new information, and then they folded these 31 pages into these 61 pages, if I remember correctly. CMS has something called the Rural Health Clinic Center, where they're supposed to update all of the information related to rural health clinics. You notice the last update was 11/7/2022, so they don't exactly do the greatest job of updating, but it has a wealth of materials on there, and you'll want to bookmark this and go to this place often because it will be very, very helpful to you. Here is the latest version of the fact sheet. If you Google this and you get a picture, first picture is different than this, you're getting an old version. So make sure, and a lot of links that we have, I know, go to the old version. I have a hard time getting my hands on the new version when I Google it. So make sure that you've got this picture, and that will be your latest fact sheet. Here's what is in that fact sheet here. It's here's the table of contents, and then here is what it looks like. So you can see it's very easy reading. It's laid out very nicely, and so you definitely want to get that. So, and then fact sheets. One thing that will really help you as rural health, I know as consultants, I always use these fact sheets. So if anybody has a question about vaccines or Medicare secondary payer, I am not this human computer that knows every single fact about Medicare and rural health clinics. I will refer to these fact sheets, and you can typically find your answer relatively quickly from those. Here's the Medicare Part D fact sheet, where today I looked up the things that were covered in this seminar or webinar. I had to look up which things were covered under Medicare Part D, and so it was very helpful. Here's UBO4 claims manual for Chapter 9. When you're completing your UBO4 and filling out your field locators for that UBO4, this is where you're going to find how to fill that out. Here's some of the things here, like field locator 46. What goes in 46? What's the number of units? Field 47 is a description of the CPT code. I think 42 is the revenue code. 44 is the CPT code as well. So all your field locators will be located here. It will also describe the condition codes, the value codes, and the occurrence codes for Medicare secondary Part B billing. That's going to be found in Chapter 9. It will also be found in that Medicare secondary payer fact sheet. So you'll want to go there. Here's what Chapter 13 looks like. The latest version, I think, and that's an older. I should have changed that picture because there was a version. It's updated in January of 2023, if I remember correctly. Here is what the Rural Health Clinic Center website looks like. It's going to look exactly like this. I copied this picture over yesterday. It has a ton of great information in here. You can see the links just keep going and going. You can spend a ton of time just on this one website. I will point this out to you. If you want to get a listing of all the Medicare certified rural health clinics in the country, there's 5,400 of them. This is where you're going to find that link. That will also take you to what's called QCore. QCore will give you a listing of every deficiency of every rural health clinic in the country. So it's really amazing. It's an amazing learning place for you to go to. Is called QCore, and you'll want to go there. Trying to see some of the other things here. Conditions for coverage, conditions for participation, or for rural health clinics, it's conditions for certification is the specific terminology. For that, that's a link to Appendix G. So an excellent place to find billing information. Also, CMS has a 43-page document about billing. If you're in a hospital, you really need this document because it has listings of how to bill all the different services that you have. If you're in a hospital, you're going to have you'll have a nursing home, a swing bed, you'll have a home health agency, you'll have a rural health clinic. all those different ones, they have it all laid out for what the service is, the billing information, how much the patient cost sharing, the deductibles and copays, and where you can find more information on that particular service. So that will be extremely important. It tells you, how you do your flu shots. Here's your stuff on hepatitis B. Medical and nutritional therapy, that is confusing for rural health clinics because the FQHCs do get paid for that. It does count as a visit, but for a rural health clinic, they do not count. It does not count. So keep that in mind. And then make sure you sign up for MLN Connects newsletter. They come out every Thursday, and it's super important that you watch those because this is where you're going to get the fastest information from Medicare. That RHC CMS website that I showed you earlier, like I said, where was that? Right here. This thing was last updated according to the website yesterday was November 22nd, 2022. That's not very current. This is very current here. This will give you the latest information every Thursday morning. You will get this, and today's gave us some great information. Number one, telehealth claims with the modifier CS, they were rejecting those. Now, if you'll refile those, the cost sharing will be waived on the HCPCS code G2025. So that's been an issue. We talked about that yesterday in the office hours, the virtual session. That was fixed today. So you can resubmit those claims and get those paid. So that's great news. Also, this came out today. For you guys that are provider-based RHCs, your cap is going to go up by 4.6%. So a little bit higher inflation factor than we normally see because we have a little bit higher inflation than we used to. So still not what your true inflation is. They still sort of fudge on the numbers, but that is a nice increase for you guys, for your grandfathered RHCs. For your independent RHCs, our rate is going to go up by a statutory mandated $13 per visit. So it's going to go from $126 to $139 next year. Okay, and then you can go into MLN Matters transmittals. This is where you can find out information about how to bill rural health clinic services or Medicare services in general. What I always do is I go in and on the filter, I'm going to filter rural health clinics and I'm going to look for any transmittal. It will give you the most recent ones will show up first, and go through and read those on occasion just so you can see what has changed. MLN Matters transmittals. And then here was just one of the MLN Matters here about vaccines the other day. So I'm not going to go through that because we lost some time on the because of the internet being down, but we'll go on. Jurisdictions, you need to know what your MAC is. A MAC is a Medicare Administrative Contractor for your particular rural health clinic. A lot of rural health clinics are what's called out of jurisdiction, which means you could be in California and Palmetto would be your MAC. So if that's the case, don't worry about it. That was the way it was before 2009, before the Medicare, I forgot the name of the law that changed it, the Medicare Improvement Act of 2009 or something like that, changed the way MACs are. The state, there's like 15 different MACs in the country. Palmetto is the one that we typically deal with because we're located in Tennessee, but you should have a MAC for your particular area unless you're out of jurisdiction. Now, what I would recommend is if you have a question about rural health clinics, is look at the different MACs and see how they're giving you guidance, because different MACs have basically, they have the same information. It's just some of them are better at actually relaying it to you and make it in an understandable form. So CGS is doing a good job here on this. Let me see here. This is from Noridian. Noridian has this is like 10 pages of of, my cat is biting me underneath here, so please quit attacking me, cat. But they have this is like a 10-page tables of all these different numbers here, like your bill types, your provider number ranges, the types of providers that can be providing services, and really lots of good information for a cheat sheet for you on billing. Palmetto even has a module for you to learn how to bill rural health clinics. So even if Palmetto is not your Mac, go through and look through that module, and that will help you to learn how to bill RHC services. And then this is the final slide here, artificial intelligence. I know that's a big thing. It's actually 1 year ago today, Chat GPT was actually open for business, and it is really neat. We have a really neat project that we're going to start as soon as we get access to the professional version of Chat GPT. We're on the wait list, but we've got a really neat project that we're going to roll out. Trent and I are going to work on it, and we're going to have something pretty neat in the future. As soon as we can get access to it, we're basically just going to upload every single memo on rural health clinics and open up and develop what's called a GPT, and you can get questions, and it will only answer the questions on this PDFs that we've uploaded. So it's going to be a pretty cool project. We just got to get access to it, and that will answer a lot of your questions. Which, speaking of questions, do you, Danny, do we have any questions in the question box there?
On specifics, Veronica had asked, what is the website again? But I'm not 100% sure what website she was referring to, if it was ours, if it was to look something else up.
Yeah, well, I mean, the good news is all the links are in, pretty much if I use anything, I'm going to put a link in there of where I got that information. So just look through the presentation and you're going to find a link somewhere in there. And so any other, let me see here. Any other questions?
No, sir. Oh, here we go. Is there a place I can find information on clinic or physician criteria for HPSA physician bonuses?
Probably your best bet is called Joe Lampard. If you were on the session on Tuesday, I would go to HPSA IQM, because Joe and John and Alex Johnson, they all know all about those bonuses, and they're very good about helping you. So I would just call Joe at HPSA IQM Inc. in Jamestown, New York. That's your best bet. Okay.
Lisa had said her taxonomy code has not been updated to the one in this webinar, that she's still getting paid a wraparound. Lisa, I know your situation. As long as it matches your 855, like what's on your NPI and what you have in your Kentucky Medicaid portal, as long as they match, you're going to be paid your wraparound.
All right, good deal.
Yeah. And that's all, Mark, that I've got so far.
That's all? Okay. All right. I was going to say, I was looking for Patty. If Patty texted me, said that that I was having problems, which meant she was listening, but I can't. Can you see Patty? I was going to open up her line and see if she had anything to say, but she might have had another meeting to go to. Okay. All right.
Aubrey, Aubrey
yeah.
asked if there's somewhere where we can get all this information from. I think Mark's going to send out an email that will have the documents, Aubrey.
Yeah, it's in like 3 different places. I mean, it's on our website, it's in the Facebook group, and I'm going to email. I've already emailed this to everybody that was signed up as of like 11 or 12 this morning, but I'm going to send out another email with the slides as well. So I'll send that out.
Okay.
All right, well, thank y'all. Again, I apologize for the technical difficulties. I guess bandwidth bit me today. So okay, but thank y'all. And we will see you next week. Remember, next week, we're gonna have Amanda and Patty talking. So it'll be a lot better than today. Thank y'all, bye-bye.